Certified home health care agency that is owned and operated solely by registered nurses, all with advanced skills and extensive experience in home health care. Call us at 888-422-3578. Our team of caring professionals include registered nurses, licensed professional nurses, registered physical, speech, and occupational therapists, medical social workers, and certified nursing assistants. Visit our website at elitehomehealth.com. All employees are subject to detailed background and reference checks. Their team-oriented approach ensures an optimal outcome for all of our patients. For more information, call us at 888-422-3578.
Hi, good evening, and welcome to tonight's show. I've got Dr. Max from Maximum Medical Robotic Hair Clinic with me tonight, and he is going to talk to us about how to make your hair grow again. So how you doing, Dr. Max?
I'm doing great. Thanks for having me, and I want to appreciate the opportunity to talk. Thanks for Elite Home Health.
Yeah. So how's business right now? Is a lot of people coming in to regrow their hair?
Absolutely. It's a holiday season, so everyone think how to improve their look, and that's what we do. We help men and women to regain their confidence, to get their hair back, and we have different options to offer.
So what is the main cause of hair loss?
Well, the most common cause of hair loss, of course, is what we call androgenetic alopecia. And this is both men and women are affected, and it's a gradual process, take years to become evident, right? But of course, there are different other very specific causes of hair loss. But the most common is androgenetic alopecia.
So what's your procedure for replacing the hair?
Initially, of course, we see the patient in the clinic, and we have a very strict protocol with a lot of tests to determine what's the cause of the hair loss. Mm-hmm. And once we determine what exactly causing that, and then we decide which the best treatment would be.
So you mentioned basically hormones as one cause of the hair loss.
Absolutely.
And what are some of the other numerous factors?
So it's not actually the hormones, but what happened over time, we might have an excessive DHT, which is dihydroxytestosterone, which is a kind of a byproduct of testosterone, and that's what actually causes maturation of hair follicles become smaller over time, and they finally disappear, right? So
it causes the hair follicles to just shrink and disappear?
Absolutely, and that's a gradual process happening in men and women. And that's why some of the therapy for example, for male pattern baldness is finasteride, which actually blocks those hormones from conversion from testosterone into DHT, into dihydroxytestosterone.
Oh, okay. So what blocks it again? What is it that blocks the conversion to DHT?
Well-known Propecia or finasteride. That's a generic name for Propecia.
Oh, okay. So DHT is one, the hormones, and then what are the other factors that you were mentioning? Is it nutrition?
Well, nutrition.
Toxicity?
Of course, nutrition could play a big role. Some vitamin deficiencies, such as vitamin B, vitamin C deficiency, although they're very rare, especially in our society when we have a pretty balanced diet and living a healthy lifestyle. But stress could be a big risk factor for the hair loss. Stress will cause excessive levels of cortisol, and as a result, can result in hair loss.
So high cortisol equals hair loss, so don't get stressed.
That's absolutely. Living a healthy lifestyle, exercising, and that definitely will reduce those risk factors.
Well, how long, when I come in for testing, how long is it before you can actually officially diagnose what my cause is, what my treatment plan is?
Well, and that's what exactly I wanted to address. It's important to have a very individualized approach to every patient. So I will, as soon as I see men or when walking in, I start with a thorough examination, questioning, and then we kind of develop the plan together, right? So that's where it's important to have a specialist. If you consider getting a treatment or address problem with the hair loss, it's important to research a doctor who does it. So you get the best care.
Right. So if I come in, it could be maybe a session or two before you've kind of really isolated what my cause is, and then where we're going to go from there.
Absolutely.
And
yes.
you're going to address nutrition with me. Are you going to put me on a nutritional plan if it's a nutrition issue?
That could be. So, for example, one of the possibilities of the hair loss is hypothyroidism, low thyroid hormone. So,
Yeah.
my assessment will include all the lab work to check for any anemia, to check for low thyroid level, right? A microanalysis of the hair follicles, microanalysis of the skin to make sure there's no autoimmune condition, such as alopecia areata, which is very common in women as well.
Oh. So if it is a thyroid issue, do you work in combination with an endocrinologist to kind of find the right treatment, like Armour Thyroid or Synthroid or some other combinations of
Oh, yes, absolutely.
typical
Absolutely.
medicines?
So, yes. So I have my colleagues who are very experienced endocrinologists. So in case we do need to address some hormonal deficiencies or hormonal excess, then, of course, I will refer to get further treatment.
for that?
Same thing with dermatologist, right? The purpose of the exam is to see if the patient is a surgical candidate or non-surgical candidate, and then we have other options how to address it.
What's the average age of someone coming in, both male and female, with alopecia?
Yes, for men, it can start as early as 16 or 17 years old.
Did you say 16 or
Absolutely.
17 years old?
Absolutely, yes.
Devastating for those young men out there.
It is absolutely, and it's of course hair loss has a very strong genetical predisposition, and I've seen quite a few very young men, boys with the hair loss, and of course there's a big emotional problem that it could cause. Yes.
Is that because their hormones are changing and that's what's causing the hair loss? Is it?
Well, typically, as I mentioned, there's a big genetical
Component?
dependency. Yes. So, of course, we cannot change our genetics, but we have different options how to slow it down, such as finasteride treatment or topical minoxidil treatment. PRP treatment is one of the newest therapies.
You mean plasma-rich platelets? That's what you're referring to?
Absolutely.
For our listening audience?
Yes, plasma-rich. Yes, PRP, platelet-rich plasma.
Oh, okay. So what's the average age for females? Is it typically menopausal age? The
Most
menopausal age when
common,
they
yes,
hit?
yes. Postmenopausal women are more
Likely to
sensitive,
lose?
yes, to have some type of hair loss.
So let's talk about the treatment options. Let's talk about robotic treatment options, surgical options. Can you explain what that's like?
Yes, so there are different, looking historical, there are different options, surgical options how to treat the hair loss. It's all started in back in Japan in 1950s when one of the doctors started using big punches to extract hair from the permanent zone of the back of the head and then transplant to the front.
Oh, can you explain more what you mean by big punches?
So back then, there's a circular punch like
Like a device?
like a device that was basically punching big holes in the back of the head and creating those large grafts.
Okay.
And these grafts they're implanted into the front of the head. Okay, the idea was that with the typical male pattern baldness, we don't lose hair in the back of the head, on the sides of the head. We lose hair on the top of the head, and this is pretty much the general principle behind any hair restoration procedure. That we move DHT-resistant hair or the permanent hair from the back of the head to the front.
Okay. So you move the good hair follicles to the front
Yes.
of the hair, basically,
That is correct.
and then it grows new hair.
Yes, and they continue to grow in the front of the head. So, of course, over the last 50 years, the technology has improved, and surgery became less invasive, faster, and the results improved significantly as well.
Which,
So right now, basically, we have three different options as far as when choosing the therapy. The older method, called strip method, is when we take a blade and we excise the tissue from the back of the head. Then it is manually divided into the smaller grafts, and those grafts are being implanted to the front of the head. Then we talk about a follicular unit extraction method. When we take a smaller punch, less than 1 millimeter, and we extract the hair follicles one by one from the back and the side of the head, and then they're being implanted to the area of the hair loss. And the third one is one of the newest and I think more advanced methods that all the extraction, all the punching of those grafts is being performed by the robot.
okay. So we're going to go to a commercial here in about a minute, but I want you to tell folks where your clinic is and your phone number and your website so they can check you out.
Absolutely. So we have two locations. We have a location in Fort Lauderdale and Miami. Fort Lauderdale is located on 551 North Federal Highway. Our website is very easy to remember. It's bringbackhair.com, bringbackhair.com. And you can call us at 833-MORE-HAIR.
That's great. Hey, this was brought to you by Elite Home Health Services. We're going to take a commercial now, and we'll return with Dr. Max to talk about how you can replace your lost hair.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects, provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
Don't tell me something else.
Non-surgical.
And we are back with Dr. Max with Maxim Medical Robotic Hair Clinic. Dr. Max, you've been in the business for a while. Tell us about your background.
Yes, I've been in hair restoration business for a total of 8 years. I started with more traditional approach using what we call the strip method, and with the scalpel. And for the last 3 years, I was exclusively working with the minimally invasive robotic technology, as well as a manual follicular unit extraction.
Okay. So before we get into that, I want to hear more about where you went to school and, where you did maybe some general surgery. I think you said you were
Yes. So I was training internship in general surgery, and I had
Where was that at?
It was in Michigan State University.
Okay.
And I did my medicine residency in Wayne State University in Detroit.
Oh, okay. Great schools.
Yes, thanks. And I'm still active as an Army physician, and I did it for the last 10 years.
Okay, so you still do some work for the Army. How often do you work for the services?
Well, I
there?
have to drill every month.
Oh, okay.
I'm in active reserve. Yes.
Oh, okay, great.
Yeah. Medical.
Let's talk some about some of the different methods that you use based on each client's, personal need. What are some of the different techniques that you use to restore the hair?
Right. So as we started to discuss previously, robotic hair restoration is one of the things I do most commonly.
Mm-hmm.
And
so that's a robotic man who stands there and actually
Well,
transplants the hair, or what does this look like?
Well, actually, it's a perception, but in reality, the robot is an assistive device. Okay, so I would not call it robotic surgery. It's robotic assisted surgery. So you always look at the surgeon who actually control the interface, who control the anesthesia, who design the hairline, and he's the one who is responsible for the outcome, of course.
Okay. So he programs the computer, and the robot does
Right.
what?
Well, the robot actually does the most tedious work.
Mm-hmm.
It's the
cutting of the hairline. What is considered the most tedious work?
The tedious work is actually extraction of hair follicles. So, our average case will involve extracting, say, 25 to 3,000
Follicles?
follicular units. So, to understand a little bit of anatomy, right? Our hair grows in little groups. They call follicular units. They could be anywhere from 1, 2, 3, 4, even 5 hairs that combine into one follicular unit. So when we talk about follicular unit extraction, we don't pull the hair one by one, but we extract those anatomical follicular units.
That grow multiple hairs.
That is correct. So you can have,
It's like a little farm with patches.
Exactly. Yes, it's like you can have different bushes. One
Group of
one can have-
cabbages, group of turnips.
That is correct. You can have 4, you can have 2 or 3, and they combine together. And that's why every graft could have 3 or 4 hair follicles. And what the robot does, it's very carefully select each hair follicle without harvesting too much, right? Because we do want to keep some of the hair in the back. So
Can he tell or he or she, the robot, tell a good follicle from a bad follicle?
yeah, our robot is she or he. Actually, yeah. Well, actually, we'll
you
decide
name
about that. Yes. Okay. So so the robot has an ability to skip, for example, single units, right? And the impact is big because let's say if we got 1,000 grafts with 3 hair follicles in each. We actually got 3,000 hairs,
Right.
Right? But if we got 1,000 grafts with just 1 hair in each, it's only 1,000 hairs. So the robot has very selective and fast processes. Scans every hair follicle 60 times per second.
Wow.
So it knows exactly in which follicular unit has the most hair follicles.
So it does maximal harvesting
Absolutely, with less trauma to the area.
versus a surgeon doing it by hand.
Yes. So if I do it by hand, and that's why I think in certain circumstances, robotic would be more precise, more efficient. Because if I have to sit and do the same repetitive motion 3,000 times,
Wow.
probably after 1,000 times, I will feel a little bit
A little tired, a little ready to go home.
Yeah, ready to go home. But if you can add to that, maybe I had a little bit of headache before or something. So it's really operator dependent, right?
Right.
With the robots,
So the robot, just sorry, I
Yes.
didn't mean to interrupt you. The robot, of course, does it faster. So does it cut your time in half, or how fast is it with the robot compared to
could
you
s-
manually doing it?
yeah, it could save time, of course.
Yeah.
But the most important, the robot is very redundant, right?
Mm-hmm.
So it will perform exactly the same quality extraction first second and the last second. The robot does not get tired.
Right.
Additionally, of course, the robot now allows us to implant grafts. And this is something that truly revolutionary just happened just a year ago. This is the newest generation of the robot.
So
that
it could
we
harvest
have.
before, but it couldn't implant?
That is correct.
Good for it.
Yes.
So what's that process like?
So it's kind of a process in reverse, right? First we extract but then we have to make a little incision and we have to implant these 3,000 hair follicles. That typically done by 3 or 4 technicians
Wow.
who will stand around patient head and will do exact same
We talk
same
about
type of implantation.
micro incisions.
We took we're talking about tiny incisions. That's
Very
correct.
tiny. Okay.
Yes, 0.7 millimeter, 0.8 millimeter on average.
And so it's able to do a higher volume of those micro incisions in half the time, whatever.
Yes.
Wow.
Yes. The most what is really concerned people most of the time is it painful or not. Right, and the procedure is painless after the anesthesia is being administered.
So are they
So-
under a local anesthesia? Like
It
they're
is-
alert, they're aware, I'm assuming, or are they completely knocked out?
Well, they might have a little bit of sedation. We give a little medication to help by mouth, the medication to help to sedate the patient.
Do they start hallucinating, going, "Hey, there's a robot over my head"? I'm just kidding.
Well, we always remind what's going on.
So mild sedation, kind of groggy, but they know what's going on.
Absolutely.
So minimal pain.
Actually, no pain. After the anesthesia is administered, there is no pain.
What about afterwards? There's no discomfort.
The afterwards, very minimal.
Okay.
So, I do prescribe some very mild pain medication, and 90% the patient end up not taking any because they just not enough pain to justify that.
On average, how long does this procedure take?
Average, we talk about 4 to 5 hours.
Okay, so it's a long, even with the robot, it's a long procedure, isn't it?
Well, it's still a procedure.
Yeah, yeah.
Right? But we try to make as comfortable as possible. The procedure actually happen in kind of a massage-like table, so you
Oh,
can be
okay.
completely relaxed with.
So just a day at the spa.
Absolutely.
So
Cool.
I'm having the procedure. Is it just you, me, and the robot, or is there and the anesthesia? You know, the anesthesia person there who's going to be
Well,
mildly sedating me.
we have about 7 people. As I mentioned, the process is very tedious because we extract one by one graft. We check each one with a microscope,
Oh wow.
make sure that everything is okay, and only the best grafts are being transplanted.
I thought the robot already determined that was the best graft, but you still have to put it under the microscope.
Absolutely.
It could
We-
be wrong, huh?
Yes, we need a quality check. Yes, so
Yeah.
we always that's what we always do. We do have yield over 98% of the extraction actually yield to the quality grafts, which is one of the highest in the industry.
So you're saying you have a 98% success rate with the follicles that you implant?
Absolutely.
So that may be just there's like a tiny little section where my hair didn't grow as much.
Well, it's we when I look into the end result, we're looking at the extraction, right? So just give you a perspective here, an example. With the manual extraction, the yield rate would be on average between 85 to 90%.
85 to 90%.
That is correct. That means that if I do it manually and I'm an average experienced surgeon, so my yield would be 85%. That means that from each time I attempted to extract graft, I lost 15%.
Okay.
Right. My rate is about 95%.
95%. Okay,
yeah,
that's
for the
good.
manual extraction.
That's great. Well, is there ever a case where you have a patient that just has bad follicles and you can't use them and you need to borrow them from somebody else? Does that happen?
It's a good question, and I asked this question multiple times already. You cannot really use hair follicles from another person. And
Just sounds wrong, doesn't it?
Well, yeah. Well, the reason is that we do have an immune system that basically rejects any organ, any foreign organ. As you probably know, people who get liver transplant, kidney transplant, they have to remain on the immune suppressive therapy for the rest of your life.
Because the body wants to reject it.
Absolutely.
Yeah.
It is justified to give for people when it's life-saving, but obviously hair transplant is not a life-saving procedure. So,
Yeah.
but I would say 90 95% of people that have enough hair that to achieve very desirable results
With
after
that.
restoration. Yes.
Well, we're going to go to another commercial here in a couple of minutes, but Dr. Max, remind us again where you're at and how to reach you, because I'm sure there's lots of folks out there who all they want for Christmas is some hair.
Absolutely. So you can call us at 954-945-2909, or just visit our website to get most of your questions answered. It's very easy to remember, bringbackhair.com.
And thank you for that. Again, we were brought to you by Elite Home Health Services. And we're going to go to a commercial break, and we're going to be back with Dr. Max, who's going to make your dreams come true this Christmas. He's going to help you grow your hair.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects, provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no copayments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
Dr. Max. Dr. Max, we left off talking about surgical options. We talked about how, robots are assisting with the surgery. I guess now what we need to talk about is, what about manual surgical procedures?
Yes, so manual surgical procedures are definitely an option, and certain people, they might have just this option available to them, and we talk about people with very curly hair, African Americans. Okay, and the reason is the robot is designed to take a straight hair follicles. If the hair is very curly, it might not be the best option.
It's nice to find something they can't do.
Yes, but the truth is we can still achieve same results with a manual extraction with a smaller punch.
So that just means you're doing that 3,000, follicular harvesting versus...
Absolutely, yes.
So, sorry, I didn't mean to cut you off. Is curly hair the only obstacle, or are there other types of hair, like if it's really coarse, or what's the...
Well, another option, another potential obstacle here would be people with previous surgeries, a lot of strip surgeries to the back of the head that will leave a lot of scar tissue. So robotic extraction might not be the best option. Although I had pretty good success in several cases with a very good yield using robotic equipment. So most of the time I do combine it with manual extraction because I do have a little bit easier time finding these places with the less scar tissue versus the robot. Right? People with very curly hair, it's an excellent option. We do offer several cutting edge machines to help with extraction. One of these is a NeoGraft. Another one is a Trivellini device. It's one of the newest on the market. A very versatile machine that can pretty much adjust any type of hair. And
so it's a special cutting machine that actually cuts the follicle,
yes,
and it can adjust to any type of coarse, curly, straight.
Absolutely,
it does it all.
It's an automatic device. It does make extraction much easier, more precise, but it's not robotic, so it's still operated by my hand.
Oh, I see.
Yes, but the most important thing is to realize that we need. It doesn't matter how you get to your final point, how you get to your result that you want, and it is determined by the surgeon, which is the best options to use.
Yeah.
So the technology is not that important as a result. And
Right.
the result, that's what
That's what counts.
yes.
That's what's going to keep the customers. Well, hopefully they never have to return to you. Is that ever a
Right.
problem where my follicle starts dying and I have to come back to you and have this done again?
Unfortunately, hair loss is a progressive disease. So the hair that we replace will likely remain for the lifetime, but people can continue with the progressive hair loss to the back of the head or other areas that unfortunately might need hair restoration in the future.
Oh, okay. So once you do this procedure to the areas that you've done the surgery, I'm probably good to go. It's like a lifetime warranty. But the back section that you didn't get to, well, I'm probably going to have that done eventually.
Eventually, yes. But
Okay.
again, taking medications and getting those treatments proactively might slow down the process of the hair loss significantly, and most of the time we can actually bring it to the halt.
Oh, that's great. So what are the pros and the cons, though, with the different devices? You mentioned several different tools if you have to go manual, and what were some of the pros and the cons with using what device?
Absolutely. So I mentioned a device called NeoGraft. The NeoGraft, I think the best utilization is for African Americans or people with a very curly hair. And the way it works, once the extraction happens, I can actually see each hair follicle and get an immediate feedback. How am I doing with extraction? With other devices, it's kind of you do little punches and then you check after. With the NeoGraft, this is one of the application that I found very useful. Trivellini, as I mentioned, it's one of the newest devices. Was just released last year, and it's truly something that we can adjust now any type of skin, any type of hair structure, and of course, so when I start with extraction, if I see something is not completely right, I will change. I will switch to another device, so we get
In the middle of the procedure? You can just
absolutely.
make a change?
Absolutely. And that's why I always explain to my patients, okay, we'll get there some, I will select the best option for you, and we'll get
You're
as
gonna
fast
find
as
it.
we can.
You're going to find it. You're going to find
Yes.
what works, and you're going to make it work.
Absolutely.
Is there ever a time? I mean, it's probably a crazy question, but do you only take hair follicles from the head, or could you take it from the leg? It's a different type of
Absolutely.
hair, but I mean, sometimes you got to do what you got to do, right?
Absolutely. So body hair, it's an option. And for men, we can always extract from the beard. That's the closest to
What about the chest,
chest. That's another option.
back?
That absolutely.
Some people can grow it on their back, can't grow on their head.
Some people will go and get the hair removal, so you can do both. You can remove your hair and replace it to the head.
That's awesome. I like efficiency.
Absolutely.
Nothing goes to waste, right? So let's talk a little bit about. We've talked about male pattern baldness. Let's talk about female balding. What's their pattern?
So female can have a male pattern baldness. However, it's not the most common type. Okay, and when we talk about male pattern baldness, it has a scale on a Norwood. It can go anywhere from stage 1 until Norwood 8. Right, usually start with
Is that severity?
it's the severity of the hair loss.
Okay.
And you have several subtypes. We're not going to go into details right now.
So I could be a 1 to an 8.
That's correct. So with male, it usually starts with a receding hairline and receding of those temporal areas, right?
That's the uh-oh sign, right?
Yes, that's
It's coming. The big one's
the
coming.
that's the early sign. Yes, and of course, women can have the same pattern, but it's
Same receding.
That's correct, and that's what we can address with the surgical option.
Am
as
I doing
well.
okay?
You're doing great.
Okay, good.
Yes. But the typical hair loss, women hair loss is a little bit different. Hair loss in the center of the head. And
So top of the crown.
yes,
Is where they
top
lose
of the
it.
crown, and it kind of spreads laterally on both sides. And the scale was the classification was actually developed by Ludwig, and we call Ludwig 1, 2, and 3. Depends on the degree of the hair loss.
And that also determines kind of, if it's not that severe, you may do more of a non-surgical procedure maybe, right? If it's more on the lower scale.
That is correct. So today we have several options for non-surgical treatments, and some of them will include play-rich plasma. We just added a newer option called Regenera Activa, and this is something coming from Spain. Regenera Activa will create a micrografting from the good hair follicles.
So you extract the follicle and then you go inside the follicle and you take something even smaller out?
So the way it works, we extract several small hair follicles from the back of the head with the tiny punches that almost invisible, and we don't need to put any stitches or anything like that. And we have a special device that extracts a micrografting from those hair follicle stem cells, and then being injected to the areas of the hair loss. It works only with androgenetic alopecia, with the most common type of alopecia, of course.
So that means hormonal related for our
That is
listening,
correct.
for those
That is
listening?
correct. Yes.
Okay.
And it can pretty much reverse the hair loss at the early stages.
Oh, that's great. So if you catch it at the right time,
Absolutely.
so prevention is key. So again, it's just you're taking a small micro tissue,
Micrografting.
okay, from it and implanting that, and that's catching it early. So if I'm a stage 1 with the receding, that's when you would do the micrografting.
That is correct. Or you have, let's say, 30% hair loss.
That's considered low?
That's considered below, yes.
Okay.
You can have a diffuse alopecia without, and we call it a diffuse unpatterned alopecia, when you just have a reduction of the hair volume throughout your scalp. And in this case, I think non-surgical option would be the best.
The best. And let's talk a little bit even more about those non-surgical options, because, you know, you're stage 1, we'll call
Right.
it. I don't need surgery, but I need something, the prevention we're talking about. Give me some more information on the
Okay.
non-surgical
So
options.
initially, as we mentioned, we're going to conduct a thorough medical exam, and we'll try to determine other causes that can put in the hair loss, such as microcytic anemia, right? Women with a heavy bleeding, heavy menstrual cycle can have a ongoing microcytic anemia, iron deficiency.
So they're losing their nutrients every month
Absolutely.
and they can't
So-
grow hair.
So in this case, for example, iron supplement would be the best option. As I mentioned, hypothyroidism, that's another option. Other cortisol, excessive cortisol, stress could lead to the hair loss as well. We look at the scalp condition, at the hair condition, and we can determine any causes such as scarring alopecia. For example, like a lichen planus, that can, which is one of the most common skin autoimmune conditions that causes little scars, and as a result, hair loss.
I want to go back to stress, because stress is such a big thing with people these
Right.
days. Stressed, worried, rushing. So, of course, you know, calming them down, teaching them how to, you know, just not be so worried. But what do you do to lower that cortisol for them?
Well, it's really, there's not much you can do. From my perspective, what I can teach is probably what not to do. Okay, so
So if you're telling me, hey, you're stressed, this is what I want you not to do. What would you? Your cortisol's high. What are you going to tell me?
well, I think each one, the cause of the stress will be different, right?
Sure.
And you cannot completely, this part of the life, you cannot eliminate it. How you can help yourself, right? I think
Just take a
talking-
breath, right? Learn to
Yes.
take a breath.
talking to some specialists who can, psychologists, right? And before you go into medication, antidepressants,
Yes.
you can talk to someone who can help you to cope with the stress in your life.
So meditation.
Absolutely, meditation, yoga
Yeah,
has been
great.
proven, right?
Laughter.
Yes,
You bet.
exercise, people who exercise every day, they have a low level of stress, right? Good physical condition definitely helps.
Yeah, it's a good mental release and a physical release. Well, you get the endorphins from it too,
Yep.
which is great. What are so you talked about other things that cause the alopecia. We kind of mentioned earlier toxicity, but we didn't cover like what kind of toxins. What are the toxins that could basically block my hair follicle and prevent hair growth?
Okay, well, toxins.
Like aluminum?
The most well-known toxin, of course, is chemotherapy, and there's not much you can do. It's one
Right.
of the very known causes, and it's a little bit different. Chemotherapy will cause a telogen anagen effluvium condition when they rapidly shed the hair. Most of the time, people will regrow their hair once the chemotherapy is concluded. But occasionally happens that the density is not coming all the way back how
Right.
it was before.
Right.
Right.
So that's one of the major toxins. Are they finding anything with metals, aluminum? We just want to let you know we have 1 minute before we're going to go to commercial. But can you address just kind of if there's any metal toxicity that blocks the hair growth?
Well, heavy metals such as arsenic, of course, can cause hair loss, but it's not very common.
Unless you poison somebody.
Yes, absolutely.
Right. Well, we're going to go to a commercial break. But Dr. Max, remind us again what your number is, where we can find you, and how we can get our hair for Christmas.
With any questions, please call us 954-945-2909 or visit our website, bringbackhair.com.
And we are brought to you by Elite Home Health Services. We're going to be back after the short commercial break. Stay tuned.
Many patients come into the emergency room ill, but not ill enough to meet the hospital criteria for admission. These patients may still need medical follow-up, which our company may provide at home with no cost to qualified patients. Our home health skills services can assist with patient medications, medication teaching and assessment of possible side effects, provide in-home nursing assessment on any patient that you have concerns about, such as elderly patients living alone with limited support systems, or patients that you feel may not be safe at home. Provide patients after a recent fall with an in-home physical therapy evaluation to assess home safety and teach safe ambulation. Provide wound care. Provide disease-specific teaching, and much more. Medicare pays 100% of the cost with no co-payments and no deductibles for qualified homebound patients. Call us for more information, 888-422-3578. Elite Home Healthcare Services.
You're listening to the new South Florida's FM Money Talk Radio Network, 95.3, 96.9, 103.9, and still on AM 1470. You can also stream us live on FMMoneyTalkRadio.com.
And we are back with Dr. Max. Dr. Max, we left off. We're still continuing to talk about non-surgical options for, our hair loss. What more can you tell us of non-surgical options?
So I was talking about Regenera Activa therapy. The equipment was recently FDA approved, and we had several patients successfully treatment with the micrografting. It's very viable option for male and female pattern hair loss. No side effects because the tissue is autogenous. It's taken from the same patient and
put back in that same
put back
patient.
the same patient, right? So
Is that can you do that micrografting with? We talked about taking it from different body parts with the other type of surgery. Can you do that with the non-surgical as well, where you're doing some micrografting? And
absolutely. So it's not only Regenera Activa can be applied not only to hair, it can be applied to face. So we can take a good tissue and create micrografts and inject into the facial area to help to reduce wrinkles, to improve appearance of the face.
oh, so you're
Yes.
micrografting the hair follicle and it helps reduce wrinkles?
That is correct. We're actually micrografting. Small stem cells
Ah, the stem cells.
or
Okay.
progenital, what we call progenitor cells that stimulates regenerative processes, either hair follicles or in the skin to help to reduce. If we do it into the facial area, it helps to reduce wrinkles, to improve texture of the skin, collagen synthesis.
So you're
and
able
so
to
on.
identify and make sure you're not putting hair on my face, because the wrinkle reduction sounds great. The hair
Right.
growing on my face, not so much.
There's a different protocol that absolutely does not have this, this complication.
That's great. And then, what are some of the diagnostic therapies that you use?
So, as I mentioned previously, we do use a microanalysis and trichoscopy to identify potentially conditions contraindicated for surgical hair restoration. Mm-hmm. And some of course, worth to mention alopecia areata. Alopecia areata is currently is contraindicated for hair restoration, surgically. And in this case, I refer to dermatologist. The best course of therapy would be steroidal injections. And once the condition is stabilized, then we can consider surgical restoration.
How long does the steroid therapy last?
Usually lasts about a year.
Okay, so that's a
Okay.
long time to be on steroids, huh?
Yes, absolutely. And we do follow up with biopsies, make sure that the condition is under control, and we can consider other options such as robotic or FUE hair restoration.
You ever had, this is a crazy question for you, ever had a patient come in and say, oh, I hate curly hair, I hate it, but, my armpit hair grows straight, so can you transplant that?
Well, theoretically, we can transplant any hair.
But you get straight after that, right? You can get straight
Yeah.
hair.
I don't think it's going to look good, though.
No, but seriously, have you ever heard anyone said, I don't want the curly hair anymore? Is there anything you can do?
I think we don't have this option yet available, right?
Is it something they're working on, or?
I think in this, honestly, I'm not aware of anything available for the curly hair. But it might be coming soon.
Yeah.
I'm
it's
sure
just
someone is working.
Yeah, somebody's working on it,
Yeah.
right? You, I think when we were talking earlier, you'd mentioned something about kind of IV nutritional therapies that you do for people who, let's say, they're low in B12. Can you tell us a little more about that?
Right. So we do have what we call IV lounge or IV bar when people are coming in to relax. We have a very cozy room, and we can administer IV therapy with minerals, different vitamins. We have what they call the hair boost vitamin cocktail that we include different minerals and vitamins proven to
Is selenium
improve
one
the
of
hair
those?
loss. That is correct.
Yeah.
The selenium, B complex vitamins.
It's also good for your melanocytes, right? For the grain.
Absolutely.
So that's common. And anything else in the IVs that'd be beneficial? I guess you can also just give it, a good boost for the winter, right? Here's some.
Yes,
Here's
first
some
sign. So
vitamin C.
vitamin C administered IV can actually most of the time reverse first symptoms of the flu.
Oh, that's great.
So that's what I do when I have my first signs. I get 20 grams of vitamin C IV, and
You do that once a week, or?
I do it as needed, of course.
So if you're recommending IV therapy, so let's say for a nutritionally depleted client, do you have them come in multiple times a week, or what would be the regimen? I'm sure it's, per patient, but on average.
Average probably once every 2 weeks.
Once every 2 weeks. Okay, that's great. Do you have any types of laser therapy that could be used for the hair loss? Or?
Yes, there's FDA cleared a low level laser therapy, and we do have a device that actually complementary to any patient who had a procedure with us,
Oh, okay.
either surgical, non-surgical. He or she can just call, stop by at any time, and have 12 minutes of low level laser therapy.
And how does this work?
Basically, it works by applying laser energy directly to the scalp, which proven to cause vasodilation or improvement with circulation, and it is typically long-lasting. The effect lasts up to 48 hours after the
48 hours? Okay.
Yes, after the session. And
So you're
some
bringing
of the-
blood
Yes.
flow and nutrition to that follicle.
That's correct. Some of the research done with either androgenic or any type of hormonal hair loss, that some of the factors affecting hair loss, that there is less blood supply to the area.
Ah, okay.
So when we increase the blood flow, it helps with the health of the hair. It sort of works like minoxidil or Rogaine.
Ah, okay.
Rogaine form was initially used as an antihypertensive therapy, and back in 70s, and it was given to different different people with hypertension, and the researchers noticed they started to grow hair.
Wow. What a cool side effect.
Yes. So now it's been used topically for many years, minoxidil, or which is a generic name, and if applied topically, it can help with the hair loss, hair restoration in mild cases, of course.
That's great. So those stage 1 clients you were talking about earlier, this is where you start, right?
Absolutely. We do have our own formulation that include topical. You mentioned actually melatonin, and there are a couple good studies show that melatonin applied topically can be beneficial with the hair loss.
Wow. So like a liquid form of it, you just rub into the scalp?
That is correct. What we created.
Gentlemen, grab your melatonin immediately.
So what we created a topical formula that include melatonin, finasteride or Propecia,
Okay.
topical, minoxidil, and occasionally we add, based on patient's scalp condition, dexamethasone or other components that necessary.
Wow.
So you have a all-in-one formula that help to address.
And that's
most
your
of the
special
reasons of the
patented
hair loss.
formula?
It's not patent, but developed. Yes, not yet.
That's great. And what about for individuals who should come in? They're thinking, is my hair changing because I'm parting my hair on a different side? It looks a little weird. Should they just come in and just have you look at them and see if something's going on, or do you think it's worth that? I mean,
Yes, it's always a good idea. It is most of the time reported that people will not notice any hair loss unless they lost at least 50% of the hair.
oh wait, so they wait until it's just pretty bad.
Right. So when somebody coming in with obvious hair loss, that means that person was losing hair for many years. So it has to be over 50% of the hair loss for that to become obvious and noticeable.
Wow. Well, I have really enjoyed speaking with you, Dr. Max, and I feel like you've definitely educated our listeners on, solutions to their hair loss. So for all of you out there who are wondering if you're losing your hair or concerned about it, really want to make a change, give Dr. Max a call. Give him your number, Dr. Max.
Our phone number is 954-945-2909. Please don't hesitate to visit our website, bringbackhair.com. It is bringbackhair.com.
And we were brought to you today by Elite Home Health Services. Everyone have a good evening. Enjoy your holidays. Happy Hanukkah and Merry Christmas to everyone.
Thank you for listening to the Elite Home Healthcare Show. Elite Home Healthcare delivers care to you or your loved one in the familiar comfort of your own home. Medicare pays 100% of the costs with no copayment and no deductible for qualified homebound patients. Elite Home Health Services will develop an individualized plan of care to meet your specific needs. Skilled registered nurses and physical therapists will plan and implement your care, along with your participation and your doctor's guidance, assuring a plan specific to your needs. We'll make multiple visits to your home over weeks or months to make sure you are recovering according to plan. For more information, call us 888-422-3578. Join us for more information and news on our next show.
You're listening to the new South Florida's FM Money Talk Radio.